Hello everyone, my name is Mary Clow and I am an Indiana State University nursing school student. Today I'd like to talk to you about medication management, specifically looking at our senior adult populations. If you would right now, just pause the video for just a moment and take our pre-quiz to see what you understand about this subject. Thank you. Okay, moving right along, our learning objectives. What I'd like you to get out of this video is just how important keeping track of your medications really is and what could happen if you don't pay attention to what medications you are taking. And of course, check in. It's always advisable to check in with your healthcare provider to see if there's something that you can do or need to do about managing your medications. According to the U.S. Census, most current results from 2020, they're projecting that by the year 2030 to have approximately 73 million senior adults. What is the significance? The National Institute on Aging reports that between the ages of mid-50s and mid-80s, approximately 80% of senior adults will be on at least one prescription medication. And at least 50% or half of these adults will also be on more than one, 5 or more. That's a lot of medication. Along with the increase in medication comes with it the added risk for problems. So here is a list of just a few things that could cause you to have problems with your medication management. People forget to take their medications and might take too much because they did not remember that they took the medication. Over-the-counter medications reacting with prescription medications, foods, alcohol is almost always not a good thing with prescription medications. Mental health issues such as depression can be intensified with the use of other medications. Addiction can be a problem, as can accidental death. Approximately 450,000 emergency department visits yearly are senior adults with some type of medication problem. That's 7 times the national average. And these numbers are coming from the Centers for Disease Control. And they also state that most of these occurrences are preventable. One out of every 25 senior adults are at risk to have a serious drug interaction. Okay, here is a slide of just some of the most common medications that people tend to have problems with. Insulin is very important for a diabetic, but it must be managed very carefully. Too little or too much insulin can cause great harm. Cardiovascular medications, blood pressure medication, blood thinners. Here's an example. You have a headache, so you reach for the aspirin. Did you know that aspirin thins the blood? If you're already taking Coumadin or warfarin or another blood thinner and you take aspirin, then it can cause your blood to become too thin. Opioids, morphine, oxycodone, hydrocodone, codeine are just a few of the names of this type of prescription. As we age, our metabolism slows down and our response to medications is not always the same. Accidental deaths do occur when people take more than prescribed. Now that we know why it is so important to manage our medications, let's look at a few handy tips to avoid some of these problems. The first thing we need to do is take a look at our current situation. Okay, tip number 1. Make an appointment to see your primary care provider. Bring your medications with you. I would suggest just taking everything, scripts from this doctor and any other doctor that is prescribed for you, any over-the-counter medications, for example, Tylenol, vitamins, any herbal supplements, bring those with you. Know your health history. Know if your family has any reactions to any medications. Know what your diagnoses are. Know if you have any allergies yourself. If you need to bring someone with you to be a second pair of ears, sometimes that's helpful. Ask for written material. Sometimes these visits can be overwhelming, and you get home. I've done it myself. I've gotten home and thought, now what did they say? And having written material is very valuable. Okay, our next tip is talking with your pharmacist. Try to keep all of your medications within one pharmacy. That way, your pharmacist is better able to help you with your medications. They get familiar with your allergies. For example, Mr. So-and-so is taking this medication from one provider and then sees a new provider who provides a script that is not going to work well with the first prescription. The pharmacist can catch that. This is one of my personal favorite tips. Check with your pharmacy to see if they offer compliance packaging. This does away with the bottles and actually portions your medications according to the time of day you take it. Color-coded. Great if you tend to forget your medication. It's got your medications listed, the doses. It's very handy. Here are several methods that work well for quite a few people. Making a medication list, pill boxes. If you're tech savvy, you can use your phone to set reminders to take medication, or having a family member or trusted friend help you with medication. Okay, here is our final and most important tip. All of you, doctors and nurses can tell you what our expected effect of medication will be for your condition. We can explain to you what adverse effects might happen, but we are not you. So we need to hear your voice. If you are uncomfortable with taking a medication, maybe you can't remember to take it, maybe it makes you sleepy, or you feel dizzy when you take it, or you have a rash that's just driving you crazy. We need to know these things so that we can help you find a solution that is best for you. We need your voice. And finally, we're ending with a quote. It's your life. Live it well. I've included the websites from the National Institute on Aging and the Centers for Disease Control as well. Please don't forget to take the post-test at the end of this video. Thank you for joining me for this presentation.